Hello and welcome, everyone. Thank you for joining us today. My name is Alyssa Tay, and I'm with the Collaborative for Health and Environment, also known as CHE. We are co-hosting this webinar with Concerned Health Professionals of New York, a program of the Science and Environmental Health Network. Please feel free to introduce yourself in the chat if you'd like to. I'm going to get us started with some quick housekeeping items. We invite you to type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you'd like to activate closed captions, you can do that by clicking the button at the bottom of your screen. This webinar is being recorded and will be presented with simultaneous English-Spanish interpretation, and it's scheduled to last for an hour and a quarter. If you'd like to download the slides, please visit the webinar page on our website at healthandenvironment.org. We'll put that direct link into the chat now. I'll now hand it over to our moderator, Carmi Ornstein from Concerned Health Professionals of New York.
Thanks, Alyssa. I'm Carmi Ornstein. I'm Program Director of Concerned Health Professionals of New York, CHPNY. And this is an initiative founded well over a decade ago in response to the possibility of fracking coming to New York State in the US. And we continued on following our 2014 ban on the practice. We continue our work bringing scientific and public health principles and findings to decision-making processes about fracking everywhere. And we support frontline communities and organizations who are dealing with this threat. For the past nearly 4 years, we've been part of the Science and Environmental Health Network, longtime close colleagues with CHE, our host of this webinar. We've published 9 editions of the Fracking Science Compendium, to which each of our speakers will refer from various perspectives today. We're thrilled to be bringing people together around this ever more urgent issue. We've banned it in New York, but the issue is ever more urgent in so many places, and bringing people together from across the Americas, and to introduce those who may not have been aware to the situation in Argentina. I'm really happy to introduce 3 people today that I've been incredibly privileged to work with and to share them with you today. So first I want to introduce Nancy Pinheiro. She is a technical scientific translator from Argentina. She's been involved in research and translation related to socio-environmental issues since 2016. She's a doctoral student in sociology at the State University of New York at Binghamton in the United States. And part of her work looks at the role of translation and linguistic justice in socio-environmental struggles, particularly in the case of fracking. And she connects the experiences of Argentina and the United States. She's published in academic and non-academic spaces, and she's translated several books. She's the co-founder of the women's translation collective, Territorio de Ideas, and a member of the journals New Voices in Translation Studies and Encounters in Translation. After we hear from Nancy, we'll move on to Kathleen Nolan, who is a pediatrician and environmental and public health advocate with training in epidemiology and research design. Dr. Nolan graduated with honors in philosophy and theology from St. Louis University in the United States and received her medical degree along with a master's of studies in law from Yale. She lives in the Catskills region of New York State, where she serves as Senior Research Director for the organization Catskill Mountain Keeper. Her work there focuses on articulating the health impacts of fracking and the state, national, and global importance of immediate shifts to clean energy solutions. She's the president of the New York chapter of Physicians for Social Responsibility. She's a co-founder of CHPNY and a co-author of the Fracking Science Compendium. Finally, we'll move to Fernando Cabrera, and he is the coordinator of Observatorio Petrolero Sur, an organization that's based in Argentina that aims to make energy production and consumption fairer, more democratic, healthier, and more sustainable. Fernando is a journalist, and he holds a master's degree in social sciences. His research topics focus on the social and environmental impacts of Argentina's hydrocarbon policy. He's published several articles in academic journals and newspapers and edited the book whose title we've translated as Industrial Hubs, Environmental Injustices, and Oil Industrialization in Argentina. And I will hand it over to Nancy.
Thank you for the introduction, Carmi. Can you all hear me well? Great. Welcome, everyone, and thanks for tuning in today, wherever you are. As Carmi said, I'm part of Territorio de Ideas, the women translators collective that has been working with UPSUR for almost 10 years now. And we want to thank Che and the Science and Environmental Health Network for their invitation too. Personally, I want to thank the people of UPSUR and also the Mapuche Confederation in Neuquén, because it is with them that I learn and that I do research related to translation, resistance, and language justice. And of course, I want to also thank my colleagues, Laura Berati and Laura Garcia, who've done a wonderful and painstaking translation job with the compendium, and they continue working on this project. So I want to give you a very brief background to the publication of the compendium in Spanish. And to situate it within the broader framework of language justice in socio-environmental struggles. Language justice is basically the right of every individual to understand and be understood in their preferred language. Both UPSUR in Argentina and also in association with other Latin American organizations, and concerned health professionals of New York in the US do translation work. That is the work of making technical and scientific information accessible to the general public, and particularly to affected communities. Therefore, they overcome a first obstacle. Now, we often hear that Latino communities are among the most affected in the US by the climate crisis and contamination. And given that Spanish is the second most widely spoken language in this country, and that many people who do speak English do so with limited proficiency, there's a second barrier to meaningful and broader participation in environmental justice efforts, and that is a language barrier in both regions. In the case of Argentina and Latin America in general, on the one hand, we often lack access to the type of scientific research that this compendium makes available. And on the other hand, of course, the US case study is a case study for its massive application of fracking. So taking these materials like the compendium and being able to provide quality translation in Spanish becomes a very powerful tool. But also within the US, this type of information is predominantly in English. For example, the Environmental Protection Agency, the EPA, commits to providing individuals with limited English proficiency meaningful access to their programs, activities, and services. And in addition, there are laws in place in the US that are supposed to guarantee language access, and those are, as we know, also under attack right now. However, just to give you one example, during the famous water crisis in Flint, Michigan, reporters and advocates found that Latino communities were alerted to the water crisis long after other residents, and they faced prolonged exposure to the effects of lead-contaminated water. Information didn't reach the residents because of the lack of Spanish language resources. The Frack Tracker Alliance has also emphasized that barriers to meaningful participation are exacerbated for non-English speakers, as hearings and notices are often not offered in other languages, even in regions where many of the residents don't speak English. Actually, there are some areas that in Texas that are called areas of linguistic isolation, and they are very close to fracking wells. we know that what happens on the ground and what is written on paper do not always match. So it is still up to organizations to build spaces of true access, because as the lingua franca of scientific knowledge, of technology and academia, English can be a barrier even in the US. And of course, all languages spoken in the affected territories need to be taken into account. And significantly, indigenous languages and the worldviews they express and represent. So initiatives like this strive to overcome those barriers, not only so that communities can be recipients of scientific information in their own language, but also so that they can provide their own input and knowledge of what happens in their territories on a daily basis. Most importantly, it's multilingual spaces like this one that allow us to share experiences and to learn from each other. And especially those in the global north can also learn what these brutal extractive projects look like in countries that historically bear the brunt of colonialism, extractivism, and neoliberalism. So to that end, I will now leave you with Kathy and then Fernando. Thank you very much.
Thank you so much, Nancy, Carmi, and Jay. I really endorse those goals and very, very happy to be here with you today to talk about the impacts of fracking in North and South America and what we can do about it. And I'll focus on pathways of contamination and human health impacts, knowing that Fernando is going to address some of the other elements of this topic. In talking about health impacts, I like to ask a simple set of questions. Is there a problem? Can we do something about the problem? And should we do something about the problem? So clearly with fracking, there is a problem. These are highly toxic chemicals that we use to drill and frack wells in order to extract what's called unconventional oil and gas that's not present in deep underground lakes. The chemicals include methane, brine, and additional liquid and gaseous toxins released from the fracked wells, as well as what we put into the wells. So there are multiple pathways of contamination, but primarily three. Contaminants that are released into the air through leaks in the equipment or from coming up through the well that has been drilled. Water that is contaminated underground through fractures, fissures, and natural connections under the ground that are made larger and more extensive by earthquakes and by the fracking activity, and then contaminants that are present in fracking waste. These contaminants then expose plants, animals, and people. And we've seen over the several decades now of experience with fracking, very worrisome analogies to human health problems in both plants and animals. But even more so, and a prominent feature of the compendium, are study after study after study showing harmful human health impacts. So let's talk a little bit about those. It turns out that some problems are harder to perceive than others. So on the left of this slide, you see a pump bringing up presumably gas and oil from the well here, and it may look like there's not much else that's coming up. But scientific equipment can show that there is methane and many other contaminants. Even without the scientific equipment, we can see in the photo on the top left that the methane coming up from the well often has to be burned, lit on fire, or what is called flared, to prevent a buildup of pressure. This is visible from the ground, and it's also visible from satellites that are orbiting the Earth. And if you see an overturned truck or an overturned canister storage vessel, then you can see the waste running on the ground. So both visible and invisible. On the next slide, I want to show you some of the things that can happen completely out of sight. On the left is a typical well, as you might see in a rural area. This one happens to be in Greece, but it could be anywhere around the world. And on the right, you'll see in the top what what a textbook might show as underground water and underground rock. And certainly the industry, oil and gas industry, shows things this way. Very straight, uniform layers separated from one from the other. But what we actually see when you do underground work, or if you do seismic testing, is that the underground surfaces are very fractured even before you begin oil and gas exploration. So there are pathways that water and these chemicals in the fracking solution can go into and cross-contaminate. Those are made worse when the fracking activity begins. It turns out that there is evidence for adverse impacts from fracking in virtually every human organ system. And I chose this slide because it was one of the few I could find that included a picture of a woman's organ system, in addition to what appears to be a man's organ system. You can't see it in the part of the slide that is showing here. This slide is an indication of the complexity of the human system. And in the next slide, I've listed out some of the places where we see harmful health impacts from fracking. Top line is that many studies now show premature death in areas near fracking sites and along fracking infrastructure, such as compressor stations and pipelines. People dying early is a manifestation of the multiple ways in which fracking can harm people. It's kind of a way that the human body brings together all the impacts and just isn't able to cope. There are also studies showing specific increases in heart attacks, heart failure, and ischemic heart disease. There are studies showing asthma and other respiratory disease, both onset of asthma and worsening of asthma, with increased trips to the emergency room and hospital. There are studies that indicate that people living closer to well sites have an increased incidence of cancer. And specifically, a very good study showing that ALL, a particular type of leukemia that occurs in children, is increased. This is striking because that's a type of leukemia that is also seen in adults that work in the oil and gas industry, especially very close to gas wells. Less attention has been paid to the skin lesions that show up in many people living near fracking sites. These are prominent to me because they resemble chemical burns. They're not a typical skin diagnosis as we might see in somebody coming into the office more generally. So it can point towards an oil and gas type of exposure if a healthcare professional sees this. It also is an indicator often of air exposure because the body skin areas that are exposed are those that show these lesions. Although I have seen them in people who have water contamination, then they have them all over their body because they're getting exposed in their showers. So paying attention to where these particular problems show up can help us understand how an exposure is happening. I'm trained as a pediatrician, so one of the most difficult areas for me is that near oil and gas wells, women have more difficult pregnancies with a condition called eclampsia, which is high blood pressure and other problems related to that during the pregnancy, and infants that are born preterm before 40 weeks, or infants born at very low birth weight, and in some cases, infants born with congenital malformations. This is something that was also seen in many of the animal model studies, and something that I saw when I visited Argentina in a group on the Patagonian plateau that had had very pure water until fracking started, and then started seeing in the people and in the animals a whole set of problems they had never seen before. There is also evidence in multiple studies of neurologic and psychological injuries, including seizures, anxiety, and depression. There's also, I didn't include it on the side, but there's also increased auto accidents in some areas near fracking, which is thought to relate to the earthquakes that fracking causes, which then lead to a generalized anxiety, which may show up in a tendency to have an auto accident. These studies come from around the world. They are studies that look at different levels. Some are at local impacts, some regional, some national, and many studies at the global level, including using satellites, as I mentioned before. The bulk of studies come from the United States, but there are also studies in Canada, Argentina, Mexico, England, Ireland, Europe, China, Australia, actually many other countries. But the bulk of the research is in those that I have listed here. So what are we supposed to do about this? Well, the hallmark of clinical medicine is to prevent disease. It's much easier than trying to treat disease. And to prevent illness in this case, we have to prevent exposures. But we cannot really prevent these subsurface fractures and interconnections that come from fracking. That is, the nature of the enterprise is to use high pressure to fracture the underground rock. So you have to have fracturing in fracking. You also cannot prevent leaks of gases at the wellheads, although you can try to minimize that. You cannot prevent leaks and spills of liquids and waste during transport and during storage, although you can try to minimize that. There's been an attempt to remove the fracking activities from houses and businesses and churches, places of worship, to set those activities back from where people are gathering. But the distance at which you have to go has not been precisely determined, and studies show increasing distances at which you can see harmful impacts. So initially we thought you had to be very close to a fracking site to see these impacts. Now more and more research shows impacts at 5, 10 kilometers, several miles. And my belief is because of the tendency of fractures underground to increase over time, that we may see more widespread impacts as we go out in time. Treatment of fracking-related illnesses may be difficult or impossible in some cases. And so our best intervention here is to prevent exposures by minimizing or eliminating fracking activities. Now, we all know that's a huge lift. We've managed to accomplish it in New York State before fracking got started. There have been a couple of other states that have fracking bans, and there's many places that have not been able to do it. So while we continue to do this work, we have to find good colleagues to do it with and share our experience with each other so that we can be more successful and so that we can help places that have not started with this activity to keep it banned and to begin to roll it back around the world where these harms are being seen. So this is a picture from that trip a few years ago in Argentina. And I'd like to introduce my Argentinian colleague, journalist Fernando Cabrera, for him to talk a little bit about some of the things that he has seen, witnessed, and documented in Argentina. Thank you.
Gracias.
Thank you, Kathy. We're very happy to be sharing this day with you with two big friends, Nancy, who we've known for more than 10 years, and Kathy, who was able to visit us in 2016 to see what is happening in the north of Patagonia region in a formation that governments say they dream of turning it into a Texas in the south, as if that was a good thing, and it's called Vaca Muerta. It's a formation which was the first that was extensively fractured in Latin America. It extends over 4 provinces, Neuquén, where I live, and since 2013, this province has been fractured. Today, we have around 3,000 fracking wells being drilled around very important lakes, some of the most important lakes in Argentina. My conversation today deals with some things that we've been seeing, and the compendium has helped us see that we can see every day through our work in the area to try to appraise that which we can't see. But we do know that there are many invisible impacts. What we can see is already very serious. So what we can see is that there's a huge water consumption, an extraordinary amount of toxic waste that is hard to handle. We've seen earthquakes happening where they didn't happen before, and also the occupation of land of this exploitation is huge. We've also registered a series of environmental and occupational related accidents. What you see in this picture is a fracking sand facility. And then in the foreground, you can see huge fracking hoses for water transportation to the fracking sites. And now we turn to our first topic that has to do with water. Can we go to the next slide? Thank you. Each well is consuming today, as a trend, like most of them, 60,000 cubic meters, which is around what 100,000 US Americans consume daily. But those are normal wells. There are other wells that double this amount with 140,000 cubic meters of water that is not reused. For example, in fruit production, there is a lot less consumption, but also the important thing here is that this water is contaminated and then it's abandoned. It is either underground, injected, or at 25 to 35% comes back to the surface. It is injected in injection wells, and they're just hoping that it won't contaminate the subsoil. But we are abandoning 140,000 cubic meters per well. And as I mentioned, there are already 3,000 wells fracked in this area, and we expect a lot more. Here we see another issue related to water. You can see here a big lake close to Neuquén, which is one of the most populated cities in the Patagonia. And this has been fractured through unconventional technique, but it also has conventional oil extraction. And now we see there are a series of issues happening around this area. As I was saying, another impact is the earthquakes. This area didn't tremble before fracking, since they have been registered in Argentina. we didn't have earthquakes, but since 2018, it began shaking, and we've had more than 500 earthquakes. Yesterday there was one. Today there was another earthquake in my province. There's no governmental response. Initially, they were saying that they did not know enough about the topic, that this had to be studied, but today there is just a complete silence. There's no response to the inhabitants of this small rural populations. Their houses have been affected and have cracks. The Mapuche people also raised concerns, but there is an alarming silence on this issue on the side of companies and governments. There has been, again, no public response when we know already scientifically that there's a proven link between earthquakes and fracking, something that, the neighbors have been mentioning for a long time ago. Here we can see a map made by a friend organization, the Induced Seismicity Observatory. What you can see in the small yellow stars are earthquakes registered since 2018. As you can see, there are close to Los Barriales Lake. And in green, you can see conventional and unconventional wells around also a river where Neuquén takes its water. So in 7 to 8 years, this region has shaken more than 500 times. Another key issue is the waste generated. This technique, fracking, generates an extraordinary amount of sludge, semi-solid waste that are accumulated in big facilities, places that have like 15, 20, 40 hectares, but they don't have the proper treatment capacity, and they have become spaces where they simply pile up waste and abandon it there. What you can see in the image is a picture of perhaps the most well-known case for us, close to Neuquén City. They've been trying to relocate since 2018, but they haven't finished processing the waste. This company has been involved in a criminal case, and since they received this complaint, they have been moving the waste, but they're not really following through. There's a regulation that says that they should be located more than 3 miles from any population, but they are 500 meters from populations. Some people are moving to this area meters from this dump site. And they are trying to relocate this to another plant farther away that also does not comply with minimum regulations, even if they are farther away from people. Next slide. So this is more or less what this looks like. Ironically, we call them oil waste dumps and not treatment plants because they simply pile up untreated waste. They're not treating anything. And for many years, this has been just accumulating. Finally, there is an issue that Sandra alerted us to in 2016. This is related to accidents. The compendium from its first edition said there was a high mortality rate in fracking, and shortly after that visit, we could start seeing accidents. We've had 15 oil workers dead between 2017 and 2023, and this wasn't common before. As Kathy said, there are a series of issues related to also the transportation of workers to the sites and also auto accidents. And this is perhaps one of the most dramatic situations, but there are also other minor accidents that have to do, well, not minor, but they have to do with the loss of limbs, serious injuries that are not as frequently registered, but they do happen. we also have to take into account unexpected situations, like, for example, one of the biggest oil pipelines in Argentina broke, and that is how they tried to contain the spill with a plastic swimming pool. Since from 2017 to 2023, the amount of environmental incidents registered by the provincial state of Neuquén doubled, and we're sure that that number keeps rising. As this happens regularly in the well sites, we have been seeing more and more of this type of makeshift memorials in remembrance of workers who have died. This is in a small refinery that was that exploded and set on fire, and where workers died. Here we see some of the most important known accidents that have happened in the history of the exploitation that now has 10 years. But as I said, the environmental impacts are an everyday thing. Next one. So what we don't see, what is it what we don't see of fracking? If anybody can recognize the visible impacts, we also have to be concerned about that which we can't see. What is happening underground? What are the impacts of this soil that is being highly transformed? Emissions are very hard to track for us. You can see here an image of emissions with a special camera. So we wonder, what are the long-term effects of these emissions beyond what we see immediately in the skin and other problems? We also are highly concerned, as I said, with water quality. We're not sure about what's the quality of the water we're drinking. It was always hard for us to prove the link between a productive activity and health. But in this case, there are particularities that make it even harder. One of them is the lack of political will. There is also a social consensus in Argentina related to the fact that the state-run company YPF is identified with national development, and people think this will help us solve our crisis. Finally, there is a certain lack of scientific interest and academic interest that has to do with the two previous factors I mentioned, but also it has to do with the relationships between universities and corporations, and with the high costs of this type of research. That's why in the face of this uncertainty of obtaining specific information, the compendium has been very helpful for us to learn, to try to anticipate what was to come for us. The US has always been ahead of us, both in developments and in problems. You have a higher capacity for research. So to translate what's happening there has helped us to know what could come. This is the third translation into English that Territorio de Ideas carried out together with the Ball Foundation, and it's been supported by 20 organizations in Latin America. We really hope we can continue with this. We started with this chapter, which was very helpful. Finally, we want to thank you and say that this is our little grain of sand to try to avoid the inertia and build a world where it's worth living in. Thank you very much.
Thanks so much, Fernanda. Thanks so much to all the speakers. We're going to turn to Q&A now, and Nancy Pinheiro is going to help with that too, as will the interpreters. If you have questions in Spanish, please feel free to put them in Spanish in the Q&A box. We don't have any yet in Spanish, but please feel free. Also, I should say, I'm not sure, maybe we will get to all the questions, but if we don't, then we plan to collect them, all the presenters will answer them and will translate them into Spanish if they're in English, and those will be posted on the CHE website with the other resources for this webinar. So I will pick up I'll give you a comment before a question. And that's from Craig Stevens in Pennsylvania. They have long been giving fracked finding tours in Dimick, Pennsylvania, which is basically ground zero. So everyone is welcome to get in touch with Craig Stevens about seeing what they experienced there firsthand. This is just a few hours away from New York City and Albany. I believe Rachel is putting Craig's contact information in the chat. So please, if you haven't yet, take him up on that. Forgive me if I missed that Fernando addressed this one, but how are workers in the fracking industry in Argentina resolving the contradiction of working in an industry that is also harming them and their families? Are they joining forces with the environmental movement? Thank you, Pablo, for that question.
Well, this is a topic that hasn't really had a union, a response from the union, or there haven't really been any workers' movement addressing this. There is obviously a financial benefit to those who work in the oil industry in comparison with other industries, and that really makes it difficult for there to be a meaningful debate on these topics. And the union hasn't really made it a priority to turn this into a broader discussion. So there hasn't been much movement on it when it comes to fracking.
I would also like to say that a lot of yes, a lot of the information that we have about the harmful health impacts of fracking, we have anticipated because of those health impacts seen in workers. And some of the people who have been most helpful for bringing forward the reality of these harms have been people working in the industry. It's one of the most dangerous industries in which a person can work. But it is in some places the highest paying or the most easily entered realm for employment. So we see people going into the field because they have to, essentially. So one of the reasons I focus on a transition to cleaner energy is because having jobs in solar and wind is a much preferable alternative, both for the people living near those industrial sites and for the people working in them. And I would encourage people who have access to northern Pennsylvania to contact Craig Stevens for a tour. It's through the generosity of people from Dimick and other places that have suffered from fracking that I know most of what I know, and from conversations and experiences with them, as well as from the people in Noken and the Patagonian Plateau. When people tell their stories, it really helps us as researchers, as well as then we hope going into policymakers.
Thanks, Fernando. Thanks, Kathy. I'm not necessarily going in order here because I'm going to switch to a question in Spanish. So Nancy will read that and let us know who should take that question.
Thank you, Carmi. So we have a question in Spanish. It says, thank you for the information on fracking in Argentina. I've been interested in studying the health impacts on workers and also communities living near the fracking sites. Do you know if there's interest in this type of research in the area? And just to clarify, I'm a researcher and I study the effects of endocrine disruptors on the nervous and reproductive system. I'm in touch with doctors who would be interested in participating in this research. Can I contact you here? And how have you, if you've succeeded in having scientists and researchers contribute to these problems to give further clarity on the consequences of this industry? So I'm assuming that's for Fernando.
Thank you, Nancy. Thank you very much for the question. Back in 2016, we invited Kathy and Sandra. Sandra is one of the promoters of the Compendium, and we wanted to shed light on the issue for other health professionals. We wanted to bring them into the debate. We were largely unsuccessful. It was a really interesting gathering. We visited hospitals, universities, we visited the parliament. Despite all of that, there were no meaningful sectors that could take on this issue or that wanted to take on this issue. So our policies continue working on it. Let's get in touch. Yeah, it would be really interesting to be able to do something. There's a gap. There's a lack of research on it, so it would be really useful to do something about it.
Maybe I can add that we do believe that many of the harmful health impacts are due to the endocrine disrupting function of these chemicals. So that would be a particularly good area of study. There are studies of that nature from the United States. But when you have information about that is derived locally, that can be more powerful sometimes in having that political pressure.
Thanks to you both. I just want to say there are a lot of really great questions coming in. So please remember that we'll have this project afterwards if we don't get to your question, and those will show up online. So this is, I think I understand this question. It's looking for strategies and insights about doing community-led or scholarly ground truthing and monitoring in these areas, knowing the fracking industry is saturated and or the general lack of political will. So I believe this is a question how we're getting participatory research done and also monitoring what's actually going on the ground. I mean, we deal with this a lot at CHPNY, where it feels very strange to be watching the research come in and being witness to these harmful effects. And we value the research community and the research so much, and we're, like everyone else, in a bit of a panic about what's going to happen to research. But we also know that the data is in. We know that there are all of these effects that Kathy outlined in one of her initial slides. But nevertheless, people are experiencing this. So how do we bear witness to that? How do we study it? How do we make sure communities are involved in that research? And I hope that I've gotten the nature of that question right. So if someone wants to speak to the strategies or insights on how to get that done and do it right.
There are some groups that will work with people who are interested in doing that kind of ground truthing. And it can be helpful to have a way of bringing together people who may be suffering with conditions that they don't attribute to their exposure to the oil and gas activity that's going on near them. When they come together and they see that other people were healthy until a certain time when that activity started, and now they're all sick, it becomes very real that something changed in that community. So it would depend upon each particular community, and we can make resources available to individuals. I do want to say a word about using the compendium and why I didn't put a whole lot of study citations in my presentation. The compendium is set up with simple language explanations of this research for thousands of research papers. So one of the first things a community could do is get together with a compendium and a particular concern, like a skin condition, and just search skin condition in the compendium, search asthma, search cancer. That then you can generate a list of 6 research papers and go read the research papers together. The compendium gives it to you in a simple summary format for just quick action. But if you really want to dive in on any particular subject, the compendium is set up to be easy to use for that purpose. And now to have the most recent edition available in Spanish, I think that there should be communities that organize to educate individuals and then to go to their elected officials really armed with this information about what's happening in them as people, but also how this is explained as coming from something that has come into their community, the fracking activity.
Thank you, Kathy. And I should add that sometimes our summaries of the research are quite, they're simple, but they're detailed. And one of the reasons they're detailed is because some of the studies will actually be behind paywalls. And if you don't have access to an academic library, then we've done that work for you. So in a lot of cases, you can get the complete study if you want to go beyond our summary, but in a lot of cases, that's just not possible unless you have that access or want to pay a certain amount per study. So just thought I'd let you know that. Fernando, did you want to add anything about that kind of frontline community research question?
Well, I mean, it's a very difficult, at least in the Argentinian community, being able to take a leap to uh, discuss health concerns because there is no government response. So, the communities are isolated. And these are communities that have received a lot of negative impacts and they are in conditions of poverty. So it's really difficult to systematize something like that. And also, where the majority of the wells are densely populated. But these are sparse populations as opposed to larger cities. These are remote communities, peasant communities, and they are very distant from one another.
Thank you, Fernando. And also, Peggy Cabrera has reminded us that actually a local library can often do an interlibrary loan for specific academic articles. Thank you, Peggy. I just want to say, because it's a frontline response before we get to the next question, that Ray Kemble from DIMIC is on this call, and he gives his phone number and contact address because he has both worked in the industry and his home has been affected. Thank you, Ray, and ongoing sympathies for the situation. I'm going to hand it to Nancy to take another question that's been submitted in Spanish.
So we have Suyai Kilapan, and I'm assuming this is for all the panelists. It's how have you managed to have scientists and researchers contribute with the research to bring more clarity to the murderous consequences of this industry?
Fernando, I think you probably have the most important to say on this. I would just say in the United States, it has not been difficult. 10 or 15 years ago, there were only a handful of studies. So those investigators may have had some difficulty. But the topic of fracking became a subject of academic interest. And so researchers across the country have been able to study these impacts. They have sometimes been funded to study them by private funding. They have sometimes worked for US government agencies in the past to study this. The USGS, the Geological Society, has done important work. So academic research of this nature in the United States has not been difficult. And I think in Canada, it has. There, I have met researchers who similarly have been able to make this their area of focus. I think it is potentially more difficult in other countries, and especially difficult if the state, the government, is involved in managing, running the fracking activity. Fernando?
Yes, what we can see in the United States is there's a lot of publishing, and we cannot compare with the amount of research that we have in Argentina. The state has not done any research at all. Yeah, we do not have any of these types of governmental research like from the Environmental Protection Agency or any other agencies. These scientific efforts are individual efforts with very little budget, and we had a big crisis for the last 10, 15 years. So this is a difficult context for science in this country. So the advancements that we've had are more they're thanks to the effort of a small group of researchers or individual researchers, and it's individual efforts.
We'll probably be going the way of Argentina in that respect soon. We know already that funding is being withdrawn for some ongoing federally funded fracking-related studies. I was on a webinar where some preliminary results were presented, and they were very, very important, and they were unique. And it remains to be seen whether we will get to see that study come to fruition. So I think we've had it pretty good with research in the US, and I hope that we can reclaim that role soon. So we have an important question from Francis Walsh about methane leakage with regard to fracking activities. And this is a good question. This is huge. Fracking contributes an enormous amount to methane emissions from several areas of the world. Kathy, do you want to say a bit more about that?
So what is called natural gas in English is predominantly methane. It's methane and a mixture of other short chain hydrocarbons. So the effort is to take this methane gas, which is locked away safe under the ground, thousands of meters under the ground, and bring it up to the surface so that we can capture it and use it. It leaks from the wellheads and from every part of the transportation and use. And it's estimated that 20% or so of global warming and climate change may be attributable to this activity. So you have leakage at the wellhead, you have the flaring, which is burning of methane. So some of it burns, but some of it doesn't, and that goes into the atmosphere. Then when you try to compress the gas, it leaks out of the compressing equipment, it leaks out of the pipelines that transport it. And both Carmi and I have been advising people, warning people about the fact that it leaks into your homes if you're burning natural gas in appliances, and particularly in gas stoves. So every stage along the way, we're taking this potentially harmful substance. It's mainly harmful to the planet overall rather than directly noxious to humans. But it carries with it all the contaminants that I was talking about. So at the global level and for regional air quality, The leakage in this system is just horrible. And efforts have been made to reduce it, and that helps, but it's really marginal compared to the amount of methane. Methane is much more potent in the short term than carbon dioxide in creating that greenhouse gas effect and warming the atmosphere. So if we take methane out of the equation, we make big progress very quickly. And if we don't do that, we slide very quickly into the kinds of weather and melting glacier situations that we're seeing.
Just piggybacking on what Kathy said about gas appliances in the home, buildings are a big source of greenhouse gas emissions and problematic for the indoors because, like Kathy said, of everything the methane carries. And gas stoves leak methane whether they're on or off, which is a finding from our colleagues at PSC Healthy Energy that we feel like should get out there quite aggressively, that we think people need to know that information. This is a great question about do fracking workers get sicker than conventional oil workers? I'm not sure that much direct comparison has been done, but we shouldn't we need to say that conventional oil and gas workers face an enormous slate of hazards and injuries and safety problems on the job. So I'm not sure about comparison studies, Kathy. We could look into that one afterwards.
Yeah, I'm not aware of any direct comparisons, but it would be a good question to ask. You might be able to answer it from some of the research that's been done in both fields. There was a question I did want to answer, though, that deals with comparisons. Could I jump in here with that? There was a question about whether there's any direct comparisons of fracked and unfracked areas. And there is a recent study that it does just that, looking at areas in southern New York along a border where there were several counties that were not fracked because of our ban. And then they adjoin counties in northern Pennsylvania that were fracked because they don't have that ban. And over the 6 or 8 years of the study, the health of the people in New York stayed the same or improved, and the health of the people in Pennsylvania declined, particularly in terms of heart disease. So that was some of the heart disease information that I was mentioning, and there's a reference to that that's in the chat. That is also available, a summary of that study in the compendium if you just search for Pennsylvania and I think heart attacks. Probably the easiest way for that study citation to come up. But we knew we were doing something important in New York, and now there is very good research to show that.
Thanks, Kathy, and I put the link to that study in the chat. I'm going to skip over to a question about the translation and what we do from here. We should clarify that the latest translation done by OPSUR is of a significant portion of the compendium. It's what we call the infrastructure section, and that covers pipelines, compressor stations, all the way into the homes with the gas appliances. So that's what we have available from the 9th edition. We have some earlier translations. There's a combined 3rd and 6th edition translation. I'll put the link in the chat where you have up to our 6th edition. If you combine those two translations, you have the whole compendium. But the question here is, there are plans for more of the 9th edition to be translated. So we'll keep you posted on that. But the question is, what's the next steps needed to get the word out? Is there a campaign for getting it in front of CBOs in the US, for instance, where they live near fracking? And I'll just say, I think the person asking this is asking about everywhere because they've asked about the translation. But here in the US, we do kind of rely on frontline communities coming to us at CHPNY, and then we try to do what they need to support their campaigns on the ground. We also do like a lot. We do social media, we do all kinds of webinars and presentations, but frontline communities should definitely come to us if there's something we can do to inform their campaign further or support it somehow with the kind of information that we collect. But I think this is a great question. Maybe Nancy has something to say about what gets done with translated science. Maybe Fernando has something to say about their next steps in Argentina.
Thank you, Carmi. With regards to translation in a broad sense, as I said at the beginning, of not only translating resources, but also generating popular knowledge with people on the ground. I think UPSUR and other local organizations have been doing a great work in, like, despite the lack of resources and despite the lack of political will, and even the lack of scientific research, there is a very strong educational, I think, element in the work that they do and that is being done in Argentina and other Latin American countries. That I've seen UPSUR taking these materials to local public libraries in very small rural towns, working with teachers' unions. So I think the construction of this and the dissemination of this knowledge is very powerful. And I think perhaps Fernando can also mention there's the case in Colombia. There's an oil workers union that has opposed fracking, so perhaps that's also an interesting case to learn from.
Yeah, from UPSUR, we think as translation as a tool not only for Argentina but for everyone that speaks Spanish in Latino America. At least, like Nancy mentioned, there's a lot of Spanish speakers in United States also, and we've presented this with Alianza Mexicana and Latino America against fracking in Mexico, also with against fracking in Colombia, the Colombian Alliance Against Fracking. And in Colombia, there's a government that has allowed a couple of debates about this. It hasn't moved. We don't know if the government can change their mind, but there's some social movements. And like Nancy mentioned, this is a very important step. In 2019, well, the work union in a Congress defined that they were going to be against fracking. The 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 oil workers were not in favor of this technique starting in their country because of the health risks. And in this moment, they said, "We are part of our territory. We are not foreign to what is happening in our community." And that was a very strong force in the debate. It's getting a little bit weaker, not as much as strong as in 2019, but this is still the official oil syndicate in Colombia. So they are opposing this fracking technique.
Thanks to both. I think we probably can only take one more question, but I wanted to acknowledge that all the questions are great and we will answer them afterwards. I also want to acknowledge Marcia Richmond mentioning Dr. Theo Colburn, who I think we can she's legendary. There's stories about when fracking came to Colorado. She followed fracking trucks around and demanded to see their material safety data sheet to know what kind of chemicals were used. I could safely say she kind of launched at least some lines of research on fracking health effects. And I think That also relates to Sky Wheeler's question, which is the involvement of endocrine disruptors. And I think to do that question justice, we'll answer it offline. Thank you. And then this maybe the same goes with the mental health impacts question, which is a really good one and one that could be easily answered by doing some search terms in the 9th edition compendium. We also pulled out public health themes, including mental health problems, as one of our sort of themes in the introductory section, where we are highlighting new trends in the research, where we've gotten some data where we might not have had it before, and mental health impacts are within that. That's page 61 of the 9th edition compendium. There have been a handful of studies on stress, mental health impacts, including one, unless this came after the last edition came out, on mental health impacts in pregnant people. I think it might have, so we'll put that into our Q&A. And maybe with that, I should just see if any of the speakers would like to say anything in closing that either is a continued response to a question or something they may not have gotten a chance to say. Nancy, do you want to, do you have anything you'd like to say along those lines?
No, nothing to add. Just thank you again, all of you, for your invitation. And I hope that this type of exchanges can continue moving forward now that technology and the wonderful interpreters allow us to communicate in long distance. So let's hope we can keep doing it. Thank you again.
Kathy?
Yes, thank you. I think there's a lot here that's very concerning and can be hard to receive. It helps me that there are good people who are working on this. If you don't have fracking in your area, keep it out. That's much, much easier than it is to deal with once it is already there. But also don't give up, because there's been some surprising victories where people have had their local government stand up for them. And the more the evidence accumulates and the more we spread the information, the greater chance that it will get into the hands of people who will finally say, no, this just doesn't make any sense. We're poisoning ourselves. We have to stop. So stay with it. I appreciate you showing up today to get more information.
Thank you. Fernando?
Thank you so much for the initiative, for this encounter, and for us. The language, like Nancy said, has been a limitation for us, and how to access to the latest news of what's happening, and something, it's very expensive and it's complex also to translate everything. And this has been very satisfying for us. Recover or understand what's happening in other territories, or also let other people know in other languages what is happening. And so we're very thankful that we could talk about this auditorium. And this was foreign for us because we saw a lot of people from United States, and this is not something that we do very common. So we want to recognize the work in the compendium in their Spanish and their English version. So recognize the great job. Thank you so much.
Thanks to everyone across the Americas for participating today. This really meant a lot to us to see the RSVPs from the southern tip of South America through British Columbia and Nova Scotia. We really, really appreciate it. And thank you to Che for putting on such amazing webinars. Every webinar they do is really fantastic. So watch their website, and we will let you know when we've done the bilingual Q&A responses. Thank you, everyone.
Thank you so much to Fernando, Kathleen, and Nancy for sharing this important work. Thanks also to our wonderful interpreters, and thanks to our participants for your thoughtful comments and questions. Again, this webinar has been co-hosted with concerned health professionals of New York, and we're so glad to have worked together on this. I'll wrap up now with some quick announcements. A video recording will be available on Che's website soon, and you'll all receive an email with a link to the video. Please also join us on April 15th for the next EDC Strategies Partnership webinar, which will be focusing on children's health, assessing impacts of the exposome. We'll share that link in the chat now. We also invite you to follow us on social media and the organizations our speakers are a part of. We'll put those links in the chat now. With that, we'd like to thank you again for joining us. Thanks again to Carmi, Fernando, Kathleen, and Nancy for taking the time to talk with us today. And thanks to Kristen Schaefer, Rachel Massey, and Sarah Howard for their help behind the scenes. We hope to see you all again on future webinars.